Good afternoon, everyone. Welcome to the Conference Board's COVID-19 Radical Changes in Workforce Mental Health Needs. We're happy to have Ginger with us today on the webcast. Big thanks to them for their intellectual content that they're going to share with us over the next hour. Please note that CEU credits are available for those who attend the entirety of the live show. For those interested in earning credit, please type your name, email address, and credit type needed in the designated box below. If you wish to earn CPE credit, please also check the 3 pop-up boxes that will appear throughout the program. What you'll learn today, how COVID-19 is impacting the workforce, tips and resources to support your employees, breathing exercises with Ginger Coach Elisa, and Q&A. We're going to be doing Q&A in the chat box, which is below on your left side of the screen. We'll get to as many questions as we can over the course of the webinar. And any questions we don't get to, we'll try to adjust after the fact. My name is Greg Morrow. I'm Program Director of the Employee Healthcare Conference, the annual Health and Welfare Program, and our Resilience event. I'd like to introduce our panelists today. Nicola Kamlos is Senior Director of Product Marketing at Ginger. She holds a BS in Engineering from the University of Illinois, Urbana-Champaign, and an MBA with a focus in healthcare from Columbia University. Nicola serves on the Board of Advisors for Stanford University's Brain Health Innovation Lab, Brainstorm, and is an innovation leader for the American Psychiatric Association. Dr. Justin Hunt is Medical Director and Head of Psychiatry at Ginger. As a board-certified psychiatrist, Justin takes a structured and evidence-based approach to medication management and psychotherapy. He received his medical degree and general psychiatric training at the University of Arkansas for Medical Sciences, and he is the Chief of Mental Health at a VA facility, Veterans Healthcare System of the Ozarks, and has been active in NIH-funded mental health services policy. So with that, I'd like to turn things over to Nicola.
Thank you, everyone. Thank you, Greg, for that introduction, and everyone on this webcast for joining us today. We are delighted for the opportunity to be here with you today and share our insights on the radical changes in employee needs we're all seeing unfold in front of us during this COVID period. As Greg mentioned, it's going to be an interactive conversation today. I know we're all on Zooms and all kinds of meetings all day long. There'll be polls. We want to hear your feedback. Keep your questions coming throughout the time. I know life happens. I have internet, I have a concert of tantrums every morning. If you have to step out and want to ask a question there about something you missed, don't feel bad. We'll make sure that even if we can't get to it in the session today, that we answer and we follow up with you one-on-one afterwards. So as we dive into today's insights, we thought it would be helpful to quickly introduce Ginger, why we have expertise in this area, and why we care so deeply about this topic. As you can see up here, Ginger is an on-demand mental health care system. We have one purpose that we're working towards, and that's to enable a world where mental health is never an obstacle. We accomplish this by offering, as you can see here on the right, an integrated and collaborative healthcare system focused on addressing the barriers of access, cost, and stigma that millions around the world face, and we're all interested in addressing. We help people across the spectrum of need, from stress to severe depression, in seconds, 24 hours a day, with our coaching, therapy, psychiatry, and content. We are a licensed medical practice in all 50 states and operational in 23 countries today, which is why we care so much about the research we're going to present today to understand employee needs. So virtual care is incredibly relevant to meet employee needs during COVID. We often get asked, how does that work? Well, someone downloads Ginger and immediately they're chatting with a coach. who guides them through their care journey, offering clinically validated content when needed. If the member could benefit from a licensed therapist or board-certified psychiatrist, the coach adds them to the care team, and together they support the member over time. All of this at Ginger is powered by a technology platform that lifts the administrative work off our providers' shoulders, measures quality, and informs care decisions. Just to get you a sense of scale, almost 750,000 people have access to our Ginger on-demand mental health system, and the stats you see on the left about access there, the 44 median seconds to access a coach and just 10.5 hours to get a therapy or psychiatry appointment, are measures over the last 6 months, so they cover this COVID period we're discussing today. Finally, as we think about mental health, it's not just about the speed of care, it's about the quality. So here's just a couple of the measures that we use as you think about meeting employee needs. 70% of those in the Ginger system have an improvement within 10 to 14 weeks, and that's clinical improvement. And we also do something called a star rating. After each coaching or therapy or psychiatry session, members rate their satisfaction with the care they're getting. And across the board, we see 4.7 stars out of 5 rating. And we reach out, of course, if that's lower than a 4-star rating. This is important, not just to Ginger, but as we talk about employee needs today. It's important that people are getting better, but it's also important that they feel better too, and that they're confident and supported with the benefits they're receiving. So now I'll turn it over to Justin to kick us off with some data as a care provider on the actual shifts in employee needs we're seeing during this COVID period. Justin?
Thanks so much, Nicola. We are truly in unprecedented times from a physical health perspective, from an economic perspective, and then also from a mental health perspective. COVID-19 is certainly not only a physical health or medical crisis, it's most definitely a mental health crisis as well. We're seeing a massive shift in member demand at Ginger. And Ginger, of course, has a very unique perspective on how things are shifting in this kind of post-COVID-19 period. We are seeing a large amount of downstream mental health challenges that are showing up in our care system. We've had large upticks in the number of Ginger members who are using our behavioral health coaching, in fact, a 91% increase. And interestingly, we have seen an even larger uptick in the number of Ginger members that are presenting with even more severe symptoms that require clinical intervention, either with our evidence-based psychotherapy or our psychiatry services with psychopharmacology. And of course, as represented by the word cloud over to the right, we're seeing a broad spectrum of issues that are driving this need. And many of them are probably not huge surprises to you as HR leaders. The causes of this distress are truly multifactorial in nature, representing the broad effects that this pandemic has had on our society. At times we'll see members coming in with very straightforward fear and kind of phobias regarding the virus. Will I be exposed to the virus if I go to a less than ventilated grocery store? What's going to happen with my older parents when they try to run errands around town? Others are consumed, unsurprisingly, by anxiety about impending job loss and just kind of the instability with the economy at this time. And then other members are coming in just with, kind of good old-fashioned feelings of being overwhelmed, when they're trying to kind of transition to this working at home, and then new environment, and while also managing complex, homeschooling schedules for their children all at the same time. It's really quite the juggling act. So that's really kind of what we're seeing from the Ginger perspective. And we're very curious, actually, about what you're seeing from the HR leadership perspective. So we're now going to pull up a poll to get your feedback on what you're seeing.
Okay, while you take this poll, how has COVID-19 most impacted your workforce? I want to, a few questions came in through the chat function. So Nicola, Justin, one question was, does this run through insurance? And I'm assuming that means the Ginger solution.
We are in network with a number of plans, and we're also able to offer other options if not.
Okay. And I think we are going to close the poll in 5, 4, 3, 2, 1. Okay. You see the responses. Elevated anxiety at about 50%. Feeling isolated, 15%. Lack of work-life balance, about 26%. Family relationship stress, about 10%. And financial stress, about 3.5%. All right, thank you. I think Nicola is muted. There we go, Nicola. I believe you're unmuted now.
Okay, great. No, I think it's super interesting to hear these responses from the crowd, and I think it'll be interesting to see how that's reflected in the research here. I know just in my own experience, you can be on Zoom meetings all day and walk into the living room, have a monkey pile of kids on top of you, but still feel very alone and isolated with everything you face. Great. So can you all see this, this slide here? Great. So I think there's a little bit of technical difficulty. There was a title here, but it's really interesting, and we're pleased to announce our annual Workforce Attitudes and Mental Health Report. So to give you all a bit of background, last year, Ginger began tracking U.S. worker sentiment towards mental health with our annual Workforce Attitudes and Mental Health Report. Even before COVID, workers were facing increased stress levels. Some notable findings from our 2019 study, that 48% of workers had cried at work because of stress. People were starting to overcome stigma and were more likely to seek help across all age groups and demographics. Still, only 26% of the workforce was getting professional help for stress, even though the vast majority said that stress impacted their work. So we ran our 2020 Workforce Attitudes Report earlier this year to get an update from U.S. workers and fielded a special set of COVID-19 pandemic-specific questions just last month in April. And these are the results we're sharing with you today. To give some context, at the time of publishing, over 1.3 million people in the world had been diagnosed with COVID-19, including over 360,000 people in the U.S. Nearly 11,000 people in the U.S. had died as a result, and U.S. unemployment was at its highest ever record in history at 6.6 million people. So a bit about this research study. So our goal going into this was that we knew employee needs were shifting. As a MedPC, as Justin mentioned, we had seen this firsthand. So we fielded this study to understand these employee needs. So unlike the previous data we shared with you, this is partnering with a third-party researcher outside of the Ginger member base to look nationally at participants that represent a wide spectrum of the workforce, similar to what you all represent today. So, so from baby boomers to Gen Z and X across all age groups, an even split of male females spread across income levels, notably 40% managers included in this study, and across sizes of companies. We really wanted to get a cross-section of America represented here, and I'll turn it over to Justin right now to start on our 4 key insights that we're sharing today that highlight current attitudes toward mental health in the workplace and what U.S. workers can expect from their employers.
Thanks so much, Nicola. So as I alluded to earlier and during the introduction slides, we are truly seeing a dramatic increase in stress, from our kind of unique vantage point at Ginger, with our kind of unique perspective into employee mental health. And so, truly, stress has been brought to new levels. This massive jump, from some or little stress to extreme stress is certainly understandable, given the many challenges that workers have faced over the past 2 to 3 months in this kind of post-COVID-19 period. As they worried about the health of their loved ones, survived layoffs with these staggering unemployment numbers, lost access to childcare suddenly when school stopped or when daycares closed, the new task of homeschooling children, and of course working from home for the first time, just to name a few of the many difficulties brought on by COVID-19. So the broad effects of this pandemic are shaping up to be even more impactful than other huge events that have happened within the past 20 to 25 years. So 88% of workers reported extreme stress compared to just 16% before the onset of COVID-19. And, kind of putting this COVID-19 pandemic into perspective, 69%, so nearly 70% of workers claim this was the most stressful time of their entire professional career. And as you can see in the chart to the right, it's significantly more than the 9/11 attacks, as well as the hugely impactful 2008 Great Recession as well. And what's interesting, at Ginger, as Nicola touched on a little bit at the beginning, is we take pride in taking a measurement-based care approach to treating behavioral health conditions, so we can drive downstream and meaningful psychotherapy as well as evidence-based psychopharmacology too. And during this period, kind of comparing pre-COVID-19 acuity levels to post-COVID-19 acuity levels, this measurement-based approach is starting to generate some very interesting data for us. And just in our company metrics meeting yesterday, it was presented that the acuity has been significantly higher that's coming into Ginger over the past 6 weeks or so, with quite a few more of the members scoring positive on validated scales that we use, the PHQ-2 for depression and the GAD-2 for anxiety that we use to kind of screen folks for depression and anxiety. We're seeing a much larger burden of illness in this population. And finally, kind of an interesting kind of contextual thing that you don't always think about, we're also noting that sleep is suffering. And in fact, kind of within our member base, we've seen a large, actually 56% uptick in nighttime conversations with our coaches via text-based chat, reinforcing just how sleep is suffering. And this is the nighttime period for us is defined as 10 p.m. to 6 a.m. And that's concerning to us, kind of from a medical and mental health perspective, because we know that the short-term consequences of sleep disruption include stress and mood disorders, effects on cognitive, memory, and performance deficits, which of course can have downstream productivity effects as well. And then chronic sleep deprivation can really have some significant physical and psychiatric effects too, with men even showing some increase in mortality with chronic sleep deprivation. And so perhaps unsurprisingly, this significant stress is also directly linked to a drop in employee productivity as well. And, I think one thing that is very interesting to kind of think about, again, kind of from a contextual perspective, is that, your employees are not only trying to do all that multitasking that we've been talking about, taking care of kids and homeschooling and, using new technology at home that they don't have to usually use in their brick and mortar places of work. We're also, all of us, are trying to work during a global crisis. And this is a full-blown public health crisis. And so we would really naturally expect a productivity drop just due to that fact alone without all these additional stressors too. So, it's not surprising that 62% of workers report losing at least 1 hour a day in productivity, which is a pretty large amount if you do the calculations over time. 91% of employees working from home reported experiencing moderate to extreme stress, subsequently affecting their productivity as well. And we think that much of this is due to this kind of massive transition to working at home when not all companies were set up to do that, and all the many significant duties that have been placed upon individuals as they try to multitask in the home. Interestingly, and this is perhaps one of the most interesting slides from my perspective, is that men appear to be disproportionately impacted in our data. So just across the board, men reported that their work lives are significantly more impacted by stress during this post-COVID-19 period. And men are actually 27% more likely than women to lose hours of productivity as well. And you can see in the chart over to the right, I don't know if it's coming through on the slide, but the larger percentage numbers are related to men. So 33% of men are unable to attend meetings as opposed to 13% of women due to COVID-19 stress. And of course, my wife would probably have lots of kind of opinions on this and how women are probably a bit better at multitasking and can kind of have more balls in the air than men in general. And I'm not sure if that stereotype is in fact true or not. But one thing I will tell you that is concerning is that men certainly don't seem to be doing as well during this crisis. And research has shown that women in the United States actually make approximately 80% of the healthcare decisions for their families. And they're also much more likely to seek out healthcare than men. Men tend to kind of hang on to their problems and delay intervention for too long. And we know that's not a good thing in mental health at all. It's always better to kind of tackle these things upstream before they kind of flourish into more significant psychiatric conditions. So kind of an interesting fact, but also a very important population here to focus on as folks start to kind of return back to work. I'm going to kind of turn it back over to Nicola at this point.
Thank you, Justin. And fascinating findings, to be sure. These next two findings are now about employee attitudes, about their benefits programs, what they're looking for, the support they need. We know the folks in this room and your colleagues in industry spend a lot of time thinking about the right program mix for your populations. You're listening to this research today because you want to get ahead of the curve and do more for your employees. So the information we're going to share with you today is consistent with these unprecedented levels of stress. And this next key finding tells us that the current programs are simply not enough for the needs that employees face. So employees are struggling they believe that their company should do more to support them. So this marks a big shift from years past that we've heard about when the stigma of mental health kept people from even talking about mental health programs. Now, only 35% of workers surveyed strongly agreed that their employer was taking enough of an interest in their mental and emotional health during COVID. 65% of respondents felt like their company could be doing more to support them, and 22 of those said that their company's response was barely a disaster or non-existent. This problem, it's hard for employees to face. It's just I mentioned earlier because there's a breadth of mental health issues care, and the programs selected really need to support entirely. The silver lining here is that are betting on companies that make the investment, especially impactful for an audience like you all had about mental health and looking to do this. 93% of employees, as you can see in that graph on the right-hand side here, said that companies who have a strong mental health program is more likely to survive the impact of this COVID-19. 93% of employees put faith in companies who will provide that emotional and mental health support. So employees have made it clear that their mental health is critical to business continuity and viability in the wake of COVID. Oops. So our last key finding here, virtual care is the new normal. So virtual care has been a topic for a while. We at Ginger have been working at it for a decade. COVID has really accelerated the adoption of virtual mental health care, and it's quickly becoming the default. In this survey, just under half the population is not just interested, but has used a technology-based emotional and mental health solution, and it's a welcome shift in behavior. So virtual care has become a huge support in uncertain times. Let's dig a little bit deeper into this. 64% of respondents used a tech-based mental health service for the first time within the last month and even the last week, as you can see here by this graph. 70% of those did so to deal with COVID-related stress. So, I mean, really clear driver here of using this help, and 48% did so because in-person care was no longer an option and their counselor went online. So the drivers are twofold here. One, people are willing to go online because they need help now and they just can't wait. So they're open and willing to try something new that just might help them get what they need. Oops, headphone malfunction. And then the second driver here is that more providers are going online. And this is an interesting trend because as we've seen as a provider of care, the benefits to a provider for going online are immense. It's not just that they get the logistical control and flexibility, but if a provider joins a system like Ginger's, they have the power of technology to lift administrative burden, measure quality, and really help them connect with other providers. So they stand to benefit from virtual care, and these providers may not shift back. So virtual care will be a key support as we all as a community prepare for employees' return to work transition. So now that you've got all this information about employee needs, I'll turn it back over to Justin to talk about how HR leaders can take action to support their employees.
So we know that you guys are really at the helm of your organizations as your companies try to navigate through these challenging times. So, you know, kind of from the Ginger mental health perspective, we wanted to just kind of offer some potential tips to think about when you're addressing your employees' mental health. So, COVID-19 obviously presents a whole host of unknowns. When will the virus subside? What will happen when we start to open back up? Will there be a new wave in the fall? How will that affect my job? Will I still have a job tomorrow even? How will my loved ones be affected as they start to integrate more into society? And of course, for those essential workers out there whose job might put them at increased risk of actually contracting the virus, feelings of lack of control can even be more pronounced, and anxiety sometimes can be through the roof. So, even when life starts to kind of turn back to quote unquote normal over the upcoming months, that your employees might still have sustained feelings of helplessness across multiple different dimensions, including social, economic, and health. These feelings might persist as they kind of get back to quote-unquote normal. At Ginger, we sometimes talk about something called the scarcity mindset. And the scarcity mindset is when one is overly focused on those things that you cannot control as opposed to those things that you can control. And having that kind of mindset, and it's very commonsensical in many ways, is known to be a huge source of stress and anxiety. So perhaps one of the most important things you can do as an HR leader is create a predictable working environment amidst this highly unpredictable pandemic. And of course, and you all are the real pros on this, but maintaining open communication with your employees, being transparent with them. Don't make things even more unpredictable by not being clear with your words. And empower them by defining clear goals and establishing regular routines, such as standing meetings can provide that structure that people really need during this time. And finally, create professional opportunities for your employees that will give them the opportunity for independent decision making. So they can have more control. Give them that project or task that they can really achieve on, so they can kind of get out of that scarcity mindset that I mentioned earlier. Secondly, we were talking earlier about how COVID stress and anxiety is causing serious sleep disruption and drops in productivity. And I think much of this goes back to an unhealthy work-life balance. One piece of data that we were discussing the other day at Ginger was that since mid-March, there has been talk that the average workday has actually increased by almost 40% in the U.S. by an extra 3 hours, which means that perhaps half of Americans are working up to 11-hour days at times, and it's the largest increase in the world, which is not surprising given our kind of hard-charging American workforce. So you can see how this work-life balance can be easily thrown off. It's very hard to distinguish kind of your professional time from your personal time. It all starts to kind of get mixed together. Emails are being checked way, kind of deep into the evening, and then schooling is happening in the late morning. So everything just kind of gets mixed up and acutely stressful due to that constant juggling. So what can you guys do? I think it's very important to have commonsensical workforce policies that support healthy boundaries, such as not sending emails late at night expecting a response, keeping to time, and having a structured agenda during meetings, so you can maybe finish 5 minutes early and people can have their bio breaks before kind of going back to the next Zoom meeting or to the next in-person meeting. And even consider offering mental health days for your employees so they can refresh. During this time when no travel is happening and a physical getaway might be completely impossible, it might be very healing for your employees just to kind of take a day off and drive to the local park and just spend some time rather than doing the multitasking in the home. And finally, our third recommendation is to think about your investment in employee mental health. Once these social distancing measures are lifted and people start to return to work, things like public transportation, crowded office environments, other public fora may still cause anxiety for large swaths of the employee population. So it might be necessary to be a little bit more flexible with the work arrangements, allow them to still kind of work from home some days, think about the actual physical environments of your office that can promote not only good mental health, but a safe kind of physical health environment too from a COVID-19 perspective. Secondly, it's easy to, I think, sometimes kind of forget the importance of grief in all of this. I think we get very focused in the U.S. on the economic collapse connected to this pandemic and trying to contain the virus and all the kind of public health actions. And we forget that there might be some very significant grief associated with this vast loss of life, and grief from actually losing loved ones directly, like many people on the East Coast have experienced, guilt over maybe having survived the pandemic when others did. So you can get some very complicated feelings as these employees start to return back to work. And the Spanish flu, of course, the flu of 1918 was the last time that we had a pandemic of this nature. So we've been trying to kind of look back at kind of the historical context of that period, and it's interesting that the Spanish flu was associated with an increase in suicide in the U.S. So we really, and of course that's like the final horrible outcome we always want to avoid. So we really need to kind of think about going upstream and addressing many of these feelings before it turns into more severe psychiatric symptoms. And finally, virtual mental health would be a great approach to supporting your employees too, where they can access evidence-based psychotherapy, measurement-based care, solid psychopharmacology and psychiatry right from their home, where they don't have to deal with the anxieties of getting out to a clinic. So of course the combination of this high stress, longer working hours, lack of productivity can all start to kind of take a toll on our both our mental and physical health, and we know that those things are highly intertwined. And now more than ever, we really just need a break. And at Ginger, we have actually started a special campaign that we're calling Take Time, as is represented on this slide. And this is our main campaign for Mental Health Month, which is May. And we realize and know that breaks can certainly help you get more done. They can reduce decision fatigue, help restore motivation, especially for long-term goals, and help you stay on task. Breaks can raise levels of engagement with employees, and that, of course, is correlated with productivity. So at Ginger, we're really specifically focusing on our very hard-working frontline clinicians and coaches. So our coaches do very long, intensive shifts of 8 to 10 hours, where they are constantly texting with folks in deep distress, and you can imagine how that could take a toll after a while. So we're especially focused on them and helping them to figure out, how can they take, breaks and recharge, what's possible in their role. Being a CEO or an executive level person in the company, that might provide one more flexibility to go golfing on a Friday afternoon, or to maybe go for a run at lunch. And many of your employees won't have that kind of flexibility. So what's possible for them? Help them uncover what actually nourishes them. And then, if larger breaks are not possible, help them to consider even micro breaks too. So just those, setting a timer on your phone or whatever works for you, to remember maybe like every 20 minutes or so to look away from that screen, because being constantly connected to these electronics is not helping any of us at times. So that's kind of what we're doing at Ginger to help our frontline clinicians to take time and to rejuvenate. We also wanted to hear from you guys. HR leaders are most definitely on the front lines as well, and you're always on. So we're going to bring up a poll now to understand what you guys do to refresh and relax.
Okay, we have, how will you take time for yourself today? While you answer questions on that poll, we have a few questions that I'd like to pose to Nicola and Justin that came in. First question is, what are the demographics and professions your data represents?
Yep. Okay, great. So, so we're happy to share kind of the full PDF of these findings afterwards. I think that there was a even split almost of male-female. We had 40% managers. You can see we had almost 40%, let me just look right back, 48% knowledge workers, 38% service workers, and 20% manual workers represented in the study. But we're happy to circle back afterwards and actually
Can anyone hear me?
share the results. Yep, I can hear you, Greg. Okay, great. So I hope that's helpful to give some insight on the
Anyone?
demographic. Yep, we can hear you, Greg. While we're figuring out Greg getting back online, I do want to touch here on the poll responses we're coming in, and thank you so much for this dialogue. It's incredibly interesting to us to see how much just like getting up a walk or a hike or an exercise you enjoy can help, as well as just taking a break, blocking off time for lunch. You know, it sounds like a lot, but you know, what we've seen is that just taking these small steps can really encourage a large change. Great. So I'll wait just a second to see if Greg can. But so if we just continue along, it's important to model behavior. It's important to remember ourselves. We can take care of ourselves so we can take care of others. And you know, in that spirit, talking about taking this first step, we'd love, I'm just getting some comments here on the audio, so folks can hear Justin and myself, correct? Thumbs up? Great, thank you, Brenda and Julie and Lauren and all the wonderful people online today participating. I can't tell you how great it is to see this kind of interaction. So, so take that first step. The first step is often the hardest. People can often start with an activity. It encourages, you know, you all responded to us, you might start with a walk or breathing or something like that. Starting with an activity encourages exploration and starts people on their journey to get support and start thinking about their mental health. There's a lot of free online resource centers available. We have our own Ginger Roots featured here. Certainly it's not the only one, but you'll see here that the approach we've taken is that we looked across those top challenge areas that we're seeing in COVID. Justin mentioned that our coaches, therapists, and psychiatrists are seeing. And we took the content that really works best within our Ginger experience and made it available to the general public. So within each of these categories featured, folks can go in and experience a meditation, look at some of our clinically validated activity cards, and start. So we encourage you to use it and spread it to the general public or find help somewhere else. But most importantly, just make sure that we all can do our part and give people resources so they have somewhere to start. We've seen that a mental health benefit isn't like other benefits. Employees tend to need exposure and awareness quite a bit upfront to start to take action and seek the help that we know they desperately need. And so now I'll turn it back over to Greg and team. We thought how better to kind of start and introduce what activities might feel like than actually running one of the breathing activities for you all today, and give you a head start on taking time for yourself. So we hope you enjoy participating in this video.
In this video, I'm going to teach you how to do a simple breathing exercise that many people, myself included, find to be very useful in getting grounded and more calm throughout the day. I call this 2s and 4s breathing. It's where you breathe in for 2 and out for 4. You can also breathe in for 3 and out for 6, or 4 and 8 if 2 and 4 feel too brief for you. The reason this breathing is so beneficial is that it turns on the parasympathetic nervous system, which is the part of our nervous system that sends a message from our brain to our body telling us we're safe and can stay calm. So to get started, you'll breathe in for 2 through your nose and out for 4 through your mouth. You want to focus on making your exhale long and controlled. It's really the exhale that counts. Here we go. Let's do it a couple more times. We just did it twice, and already I can feel my body relaxing. What do you notice? This kind of breathing is so wonderful because you can do it whenever and wherever you need a little moment to yourself to calm down and get grounded. I like to use this breathing at moments of transition, when I'm walking from one part of my house to the next, from one meeting to another. These moments are times when anxiety and stress tend to creep into our mind. We're thinking about what comes next in the day, we're planning out our dinner, and instead, this is a great opportunity to just get present, get relaxed, and carry on with our day with a little bit less anxiety. Even doing this breath 3 times, which takes probably 20 seconds, can really help you to calm down and feel a lot more in control. It can be challenging to use a new relaxation technique, so something that might be useful is to set some reminders in your phone, maybe through periodic times in the day to go off, or at random intervals. If you do this more often, the more grounded and relaxed you'll feel, and the closer to calm you'll bring your baseline.
Can you hear me all right? I know some folks were having audio issues during the video. Great.
Okay, Nicola, we can't hear you, but
thank you for joining. Can you hear? Okay, you can hear Nicola. Okay, great. You know, this is just an example of COVID life anxiety. I heard Greg as well. For those of you that couldn't hear the video, we'll make sure with the follow-up there are these slides, but we'll send a link if this this activity is one of my favorites and it's available on Ginger Roots. So we'll share that with you afterwards so you can experience for yourself. So fantastic. Thank you all for joining us to listen and learn today. Hopefully you feel better equipped as you face the challenges of meeting employee needs, and you'll join us on this mission to make a world where mental health is no longer an obstacle. For those of you that joined us a little late or had to step out of the room, we're Ginger, an on-demand mental health system. We help people across the spectrum of need, from stress to severe depression in seconds. Whether someone needs help navigating a stressful situation in their life, or they could benefit from a licensed therapist or board certified psychiatrist, Ginger matches the need with the appropriate level of intervention in seconds, 24 hours a day. And so you can see a bit more about us here. We're happy to share more after the webinar if there's interest. Thank you. So, Greg, I think you mentioned a couple questions. I saw one from the audience about how big a driver were financial concerns in our research study as a function of the overall stress. I think the top drivers of stress that we saw in this research was COVID-19 itself. Personal finances were a challenge, as well as the possibility of recessions and healthcare concern, and then lack of job security. Those are some of the things that we saw highlighted in our research. I know Justin can speak to what we hear from employees just during this period as a care provider.
Absolutely. Finances and just kind of the overarching economic uncertainty is what I'm hearing in my own practice as a psychiatrist on Ginger. It's just people like the structure. They want a bit more certainty than the current pandemic environment offers.
Relates to it. I'm fascinated by the data regarding men as that I have instances that women are taking on a disproportionate amount in addition to regular workload. And then the question one is the med results due to women underreporting, possibly.
I can take this one, Nicola. It's I think it's difficult to know the underlying kind of explanatory factors with that data on men. I think women likely are taking on a brunt of much of the work at home because of the way our culture is traditionally set up, while also doing a lot in the workplace as well. I think, what I just go back to is I wonder if the women are just reaching out for support, perhaps being a bit more open with their distress. And again, this sometimes is a cultural thing too, unfortunately. Men sometimes are not allowed to show sadness. It's okay sometimes to show anger as a man, but it's not okay to show sadness and being overwhelmed. And I think a lot of that sometimes kind of gets hidden and not fully addressed, and they're not reaching out for professional help or kind of help through like a coaching mechanism that Ginger offers.
Great. I do want to provide assurance. I do want to provide assurance for everyone on the line that if you have questions in that chat that we haven't gotten to, we will follow up one-on-one. I think we can get your contact information to make sure that follow up with you. I saw some questions. I saw some questions about whether this research was over Ginger members or separate. So the care insights that Justin shared are from our Ginger experience as a provider of care. The research was conducted with a third-party researcher across an anonymous kind of survey fielded across the country.
Okay, take a few more questions. Okay, you're using the term multitasking. Shouldn't we be addressing how we create better focus as a way to reduce stress? Multitasking is a fallacy. How do we dispel it in our new work-from-home world?
Justin, I can speak a bit from like a member perspective of some resources we have, and then I would love your clinical perspective on multitasking. But you know, one way when our coaches are working with someone one-on-one and creating their personalized care plan and thinking about, hey, you're having challenges with focusing, how can we help? Some of the techniques they can use are these, we have a lot of clinically validated content that focuses and talks about, hey, while you're taking that break, how can you help refocus yourself? So that's a tool that we often use, which I think the question was asking about. And then, of course, within our care organization, as Justin can answer, we have an approach to that as well.
Yes, and I think you make a very good point and posing that question. I agree. Multitasking really is kind of a fallacy. I think we all, find ourselves attempting to do it, but we generally, when we attempt to do it, we don't do things as well as if we kind of go down a list one by one and really kind of dedicate our attention and concentration to each task. I think, as far as what we can do to kind of help out with this dilemma, because we don't necessarily want to put employees into these positions of having to multitask constantly. And of course, some of this is out of our control. The fact that schools are shut down and parents are having to homeschool is kind of a good example of that's going to provide some natural disruptions. But, from an HR policy perspective, I think it kind of goes back to that, kind of trying to create clearer boundaries, really setting those policies about, maybe the emailing deep into the night. So, allowing your employees to really have that good quality, family time in the evening, so they're not being, kind of disrupted with constant communication. I think that's where we can that's kind of our intervention point from an HR perspective.
Justin, that brings up a great point in terms of just allowing folks to get help when they need it. And it's the importance, I think that was really important to us when we thought about an on-demand system as something where someone can reach out 24 hours a day. I see some questions here about U.S. experiences playing out globally and in other countries. I will share Justin's remarks are about our global population. So Ginger's in 50 states, 23 countries around the world. So as Justin talks about these themes of care that we're seeing, it's really that we're seeing it across the world. And across Ginger. I think, Justin, did you have any further comments on that one?
No, I would agree with that. These are kind of common struggles, unfortunately, that we're all tending to.
I think we have time for just one more question. Is the data from a survey conducted with Ginger members, or does it include an external audience?
Yeah, thanks, Greg. So I think we talked a bit about both Ginger's data, so the insights Justin shared, that's over the Ginger population. The research was outside of Ginger's member base. Just quickly seeing a couple of questions coming in there at the bottom about how, if we can integrate with the benefits program that employers already have, and that's actually a key strength of Ginger. There's a mention of EAP on here. We are in network with many EAPs, large national EAPs, and that's part of our in-network strategy. So really the point of our mental health system is really working towards that goal of we want to make sure that mental health is not an obstacle, and we've built our system so that we can really integrate with the existing benefits landscape and the Ginger programs to make sure that employees are getting the access they need when they need it.
All right, I think that puts us at time. Thank you, Nicola, Justin. We really appreciate you being with us and sharing this great information. That concludes the presentation. As our thanks to joining us today, please use the, there we go. Please use the KN1 code. You can get a $300 discount to the two events that you see listed there. Our Employee Healthcare Conference is virtual from June 24th to July 2nd. There'll be about 3 sessions a day over the course of those 7 business days, and then the Paternity Through Elder Care seminar. Next slide. For additional resources related to the COVID-19 crisis, visit the Conference Board's COVID-19 Hub via the link below in a downloadable presentation or by visiting conference-board.org. And in addition, our Human Capital Insights podcast series is a great resource for talent executives wishing to address changes and stay informed about current issues across the entire spectrum of human capital. You can register for those at conference-board.org/products. And finally, if you're interested in collaborating with Conference Board to produce another program like you saw today, please reach out to us. You can discuss webcast sponsorship opportunities by contacting sponsorship@conference-board.org. Thanks again for joining us today. We really appreciate your time. Nicola, Justin, thank you so much, and thanks to Ginger for the support of the Conference Board, webinars, conferences, and other research. So with that, everyone, have a great rest of the afternoon, and please check in with us again as we deliver more content.